Brainiacs, welcome back. This is going to be a mini series. It's kind of a mix between day in the life of a counselor and patient portal. So, the gist of this mini series, if you will, is to portray the different stages of treatment, therapy, counseling, whatever you want to call it. In this video, we're going to go into the different stages of therapy. The first stage is establishing rapport, building a relationship. But this video is going to portray what a intake session looks like. Oh, that will be my first client. Come in. Hi.
Hi, how are you?
Good. Thank you for asking. How are you?
I'm well, thank you.
All right, Brandy.
Amber.
Nice to meet you, Amber. Please sit down and make yourself comfortable.
Thank you.
Mm-hmm. You okay?
Yeah.
Great. So, Amber, have you been to therapy before?
I have, yes.
Okay. How long ago?
Maybe about 5, 6 months.
Okay. Okay. So I'm pretty sure that your previous therapist shared with you about the confidentiality piece. But I do want to reiterate. I just want people to understand.
Okay, no problem.
Basically, this is a safe space. Anything that you say in here will be kept confidential, except if you tell me that you want to harm yourself, commit suicide, harm, or kill someone else, homicide type ideations.
Okay.
Also, if you are experiencing any type of physical or sexual abuse, it is reported. Also, I report that as well. Do you have any questions?
Got it.
Not your first rodeo, huh?
Not at all.
Okay. So welcome again. I'm glad that you're here. So, Amber, tell me a little bit about yourself.
Okay. Well, my name is Amber. I'm 31. I grew up primarily in Tennessee and Mississippi.
Mm-hmm.
I currently work as a nurse in the dermatology clinic.
Mm-hmm.
And I enjoy laughter, playing games, and just family.
Cool. Awesome.
Yeah.
So, what brought you here today?
Well, the only reason that I stopped therapy was because my insurance, I was in transition from one to another. And so I wanted to continue therapy.
Okay. Well, I'm glad you found us.
Me too.
All right. So, you're in the medical profession or in the field of medicine. I presume you kind of know what an intake looks like.
Absolutely.
At least in your field. It's slightly different. I like to tell people that it's similar to a first doctor's visit when you're filling out all of the demographic information. Except for once you turn your paperwork in to the office manager here, I kind of go back over some of the same things just to give me a chance to get to know you. It's different when, I do read it, so it's different from me just scrolling through and just thumbing through your intake form.
Okay.
So this is kind of conversational. I do ask a lot of specific questions, and then we can get into some things that you're willing to share.
Not a problem.
Okay. So what would you say is your chief concern? Like, what are you, outside of what brought you back, like what are you here for today?
Okay. Basically, long story short, I was diagnosed with PTSD and GAD.
Okay.
And so I would like to further understand and learn how to cope with those diagnoses.
Okay. All right. Do you remember the name of the mental health professional that gave you those diagnoses?
Not off the top of my head, but I
Okay.
do have that information in my purse. I can get that later for you if you'd like.
Yeah, later's fine.
Okay,
Okay.
great.
Were you prescribed any medication by this person or by a primary care physician?
My
Or-
primary care physician, sorry to cut you off.
No problem.
My primary care physician did at one point prescribe me Xanax,
Do you remember how many milligrams?
0.5. I did not take any. I actually still have them to this day. I hadn't taken any.
Okay.
My GAD was basically situational. So I guess it wasn't really GAD then because that's generalized, you know. So, yeah, I haven't taken any medicine, but I was given Xanax.
Okay. And your primary care physician is who?
Latoya Hopkins.
And I asked that because we usually coordinate care with other professionals.
Oh, no problem.
Yeah, and
I
I'm sure
totally
you know.
understand. That was not a thing.
Okay, all right. Any recent stressors in your life outside of everything that's going on in terms of like pandemic and the aftermath of such? Anything else? Like, for example, family conflict, relationship issues, any loss or grief you maybe experienced, any?
I guess if you really don't think about it, then, you know, it's not really happening, right?
Mm-hmm.
I did just recently, in the past couple of months, lose my closest cousin,
Wow.
as well as my aunt at the end of last year. So I guess, you know, those were traumatic events
Mm-hmm.
that happened outside of the pandemic, as well as just myself being in a state of stagnation in my professional life.
Okay. One, I'm so sorry to hear about your losses.
Thank you.
And please let me know if there's anything that we can work through together. in terms of
Absolutely.
grief. How would you report your current ability to cope?
Well, as you know, I'm in the medical field, so we always tell our patients on a scale of 1 to 10. So I'm just going to use that numeric value for reference sake.
Sure.
I would say my coping mechanism skills are maybe 6.5, 7.
So average is normal.
Absolutely, in my opinion.
Okay, manageable.
Absolutely, yes.
Okay, yeah. What about your mood? How has that been in the past month, give or take?
Maybe 5, 6.
So, on the mood, I'm looking for like an adjective.
Okay.
Anxious, depressed, happy-go-lucky, in between.
I'm just kind of in between.
Okay.
With everything that's going on in the world, I try not to have that consume my mind.
Sure.
And I try to look at the silver lining in things, as well as be a hope to someone else in the time that we're living in now. So I would probably say in between.
Okay. I can make that sound a little bit more clinical. We talked about medication. Any alcohol use?
Do I drink alcohol, like at all?
Mhm.
I do.
Occasionally, socially.
Very, very socially, and not even like every social gathering, like maybe once every 3 or 4 months,
Okay.
if that.
Sure. So more occasional than social.
Absolutely. Yeah.
Okay.
You're correct.
Any tobacco or nicotine use?
Absolutely not.
Okay.
Neither of the above.
Street drug use?
No, ma'am.
Okay. You know, we always have to ask
I
these
know it.
things.
I know it. And it's always different when you feel it from this side as opposed to asking
Certainly.
questions. So I
Certainly.
get it.
Physical health issues. Do you have any underlying conditions?
as I get older, I have a little bit of aches and pains that I didn't typically have.
Sure.
I do have an issue with my back. I
Okay.
have some herniated discs. So I do have back pain every now and then.
Okay. And who's that being treated by?
My neurologist, I can't think of her name, but like I said, all that information is definitely in my purse.
Okay.
So I have a PCP neurologist, and now a mental health counselor. Yeah, so that's pretty much it right now.
Okay.
Oh, I have an OB, but
Okay.
no.
Sure. All right. So, how would you describe your physical activity level? Active, inactive, regular exercise, fit, average?
Well, had you asked me this a couple of months ago, it'd have been like inactive, but I am glad to say that I have just started recently exercising again.
Okay. Good.
So, I would say slightly active.
Okay. Awesome. How about your sleep? Are you getting good sleep?
Listen, sleep is my BFF. Okay? My friends, family laugh at me because when I get home, I get in the bed and I allow myself time to just relax from the day and decompress.
Self-care.
Absolutely.
How would you describe your social activity, your social life?
Average. I mean, I get together with my friends. I travel very often. Actually looking forward to going to Costa Rica in July.
Oh, awesome. That sounds fun.
I can't wait.
Awesome. How about your overall level of satisfaction with your work life?
Work life, I would say 8 out of 10.
Okay.
Mhm.
All right. That's good. It's always good to like what you do.
That makes a huge difference.
Absolutely. Do you have any sports that you like to play or any hobbies?
I just recently picked up calligraphy.
Wow.
I know, I'm so
Don't hear
excited.
that one every day, but that's
Right?
cool.
Yes, I wanted to always practice on my handwriting, and so I saw this book in the dollar store for $1, and I was like, what
Why
better
not?
time, right? But I also love basketball. It's my first love as far as sports is
Okay.
concerned.
So you get to play often?
I don't get to play as often as I would like, but
Okay. Well, thank you for sharing so far. Now, this is a point in our intake where there's a bunch of check boxes that basically I'm going to ask you. Sometimes I'll do a little awkward silence because I'm looking for, because not everything applies to everybody.
right.
Like, I'm sure you're not experiencing elder care or elder abuse. You're 31.
Right. Right, this is true.
So there's some things that don't necessarily apply to
Absolutely.
everybody. So as I go through this, just nod yes or no, or verbalize yes or no. And if I get to a point where I would like to know a little bit more, I'll ask you to elaborate.
Okay.
Okay? All right. Have you ever experienced abandonment?
Ever?
Mm-hmm.
Mm-hmm.
Okay. Could you briefly elaborate about that if you are comfortable?
Maybe on another visit. We
Yeah,
can do that?
no problem.
Okay.
No problem. What about any type of abuse?
No.
Okay. Have you ever had an affair or the other way around?
Affair? No.
Okay. Okay. How about any anger issues? I know we are all human and we experience anger because it's an emotion.
Right.
But to the point of needing anger management.
I don't have anger issues. Do I get angry? Absolutely. Like you said, we're all human. But no.
I mean, I would hope so.
Right.
Any kind of eating disorders ever?
No.
Okay. Anxiety.
Absolutely.
Okay. Would you describe yourself as an avoidant person?
As a what?
Avoidant person.
No.
Okay. Okay. Any appetite issues?
No.
Okay. Body image, self-esteem, any of that?
Mm-hmm.
Okay. Both?
More self-esteem than body image? Well, actually, both. Let me just say that. Both.
Okay. Sure. Any trouble setting boundaries? No. Okay.
Sorry.
So assertiveness is a strength.
Absolutely.
Okay.
Probably too much of a strength, but yes.
Let's see. Have you ever been married?
I have not.
Okay, so divorce is not a thing. What about grief? I know you said that you lost your aunt and your cousin. Is that something that you're still going through? I know grief is technically a never-ending cycle, but is that something that you need to focus on or feel the need to focus on?
I wouldn't say so.
Okay. What about any guilt or shame or rejection or anything?
Do I experience it, or do I?
We all experience it, but is that something that is so prominent right now that we need to focus on it?
I wouldn't say so.
Okay. But if anything ever comes up, I have the ability to go back into the same primary note.
Okay.
And change something. Okay. Not in school, so grades are a thing right now. Any excessive worry? I know it's a part of anxiety, but it's on here.
I wouldn't say excessive worrying, but do I worry? Yes.
Sure. Okay. Any trust issues? Okay. Separation anxiety. I know you're a full-blown adult, but it still exists.
It does. I do actually have a little bit of separation anxiety.
Okay. Any jealousy? No.
No.
Isolation issues? Depression?
Mhm.
Family conflict?
Not so much.
Okay. I know we all experience stress, but is that something that is prominent in your life at the moment?
Stress?
Mm-hmm.
Not really. I wouldn't say so.
Okay. Relationship issues? Okay. Sibling conflict?
Nah.
Okay. Mood swings?
Yeah.
Okay. So that also leads me to impulsivity or irritability.
More irritability.
Okay. All right. Any hyperactivity ever? Irrational fears? Okay. All right. So the next thing I'm going to ask is if you have ever self-harmed or attempted a suicide or had any suicidal ideations?
No.
Okay. Any homicidal ideation?
No.
Okay. Any substance use / abuse?
No.
Okay. Great. So the last step in this is to develop your treatment plan. And this is the part where I really like to integrate the client in their treatment. So there's room for 3 goals. You don't have to have 3 goals. You can actually have more, but there's only room for me to write 3, if that makes any sense. So what would you say is your number 1 goal at the moment?
My number 1 goal for therapy right now would be to develop coping mechanisms to deal with anxiety as well as the PTSD that I was previously diagnosed with, and to explore that a bit deeper.
Okay. So I heard more than 1 goal.
This is true.
Okay. Is it okay to separate those goals into 3 goals, or do you want me to put 2 in 1 and then add a 3rd separate from it, or?
However you can break those up into 3 if you heard 3, sure.
Okay. Well, let me tell you what I heard.
Okay.
Essentially, is further exploring PTSD and anxiety. So clinically, I would write that as the goal number 1 is to how can I put it, is to decrease symptoms of PTSD and further explore. And the way that I would do that is utilize certain therapies.
Okay.
A good therapy or modality, a good modality to use with that would be DBT, dialectical behavioral therapy, and we can get into that later on. And also to decrease levels of anxiety. And a good one for that one is CBT, cognitive behavioral therapy, which also we can get into a little bit later. Do you have any questions? No? Okay. All right. So what typically happens is the next session we'll go back over these, and then we will have you sign the fact that we developed a full care plan.
Okay.
Okay. Amber, thank you so much for coming in today, and thank you so much for sharing and being open.
Absolutely.
Yeah. I appreciate you. Let's go ahead and set your next appointment.
Okay.
Okay. What day do you prefer? I'm here Tuesdays, Wednesdays, and Thursdays after school hours.
Tuesdays are probably better for me. That's
Tuesdays?
typically my off day.
Okay.
So anytime Tuesday
Okay.
is good.
I have a 3:45 open. Does that work for you?
What date is that?
That would be Tuesday the 28th.
Okay, yes, that's good. I have another doctor's appointment.
Okay.
So I can come from that and come straight here.
Okay.
It's at like 1.
Oh, okay.
Yeah.
Perfect.
Okay.
All right. Well, it was lovely to meet you.
Thank
Amber.
you.
Thank you so
Thank
much.
you.
You have a great evening.
You do the same. Thank
Okay.
you.
Thank you.